Does weakness in your legs make it hard for you to walk as long as you used to? Or do your legs feel unsteady, like they may give out? Do you find it harder to get up from chairs, go up and down stairs, or get up from the floor than you used to? I'm Dr. Dave Candy, and in this video, I'll explain 3 reasons why your legs may be getting weaker, as well as give you some tips that you can use to regain your strength and stability. Now, there are 3 primary categories of reasons why your legs may be getting weaker as you age. Number 1 is neurological weakness. Number 2 is deconditioning. And then number 3 is specific muscle weakness from muscle imbalances. So we'll go through each one of those and then give you some solutions for each of them. Keep in mind this is a very complex problem, so there may be more solutions than the ones that I mentioned in this video. Now, the first problem is neurological weakness. That basically means that the signal isn't getting from your brain to your leg muscles to tell them to turn on. And that can be caused from multiple different things itself, such as stroke, multiple sclerosis, Guillain-Barré syndrome, or other various neurological diseases. It can also be from mechanical compression of the nervous system. Narrowing of the spinal canal in either your neck or your lower back can compress on your spinal cord and cause weakness and difficulty walking, but more often it's compression of the nerve roots after they've branched off of your lower back spinal cord and go down into your legs. Now, there are lots of different things that can affect those, but the most common thing that affects it, whether it's either your neck or your lower back, is that backward bending positions like that of the neck or arched back positions of the lower back tend to narrow the spaces where the nerves exit your spine and also functionally narrow the canal around the spinal cord. So keeping your chin down as opposed to a forward head position like that, as well as keeping your lower back relatively rounded as opposed to arched when you're standing or when you're walking, can help take pressure off the nerve roots so that your legs get the signal from your brain and don't feel as weak. Now, leaning forward slightly when you walk opens up those spaces in the lower back where the nerves come out, which is one reason why you often see people leaning over a cane or a walker or a grocery cart, because it opens up the spaces in the lower back and makes the legs feel better and makes them feel stronger and allows you to walk longer. So it is okay to lean forwards just a little bit when you're walking to make more space for your nerves. So that's problem number 1, neurological weakness in the legs. Problem number 2 is deconditioning. Maybe you've had an injury or a surgery and you've been immobilized for a while, or maybe you've just gotten into a sedentary lifestyle, you haven't been doing as much activity as you used to, and you've spent a lot more time sitting on the couch than you used to. In that case, your muscles get deconditioned, and that means they lose the ability to produce energy efficiently. There are structures in your muscles called mitochondria, which are basically the energy factories of your muscles. Those are present in all of your skeletal muscles, not just in the legs, but they turn your food, glucose, into energy. Now, after you've been deconditioned and you haven't done as much activity, the number of mitochondria in your muscles actually goes down. And so you get tired a lot more quickly with a lot less activity than you used to do. And so one way to get stronger if your weakness is from deconditioning is to do aerobic activity before you get into aggressive strengthening. That replenishes the mitochondria in your muscles and allows you to walk longer. Now, walking is one good way to do that, but if you're already having weakness and difficulty walking, you may not be able to walk for as long as you'd like. So using a recumbent bike, or walking in the water or doing water aerobics, or walking, leaning over a grocery cart or over a wheeled walker to open up the spaces in your lower back are all good ways to improve your oxygen carrying capacity of your muscles, to increase the mitochondria and allow you to produce force for longer periods of time. So that's the second problem, deconditioning. Now, the third problem is due to muscle imbalances. This is where one muscle or muscle group is working too hard and another muscle group isn't working enough. Now, there are way too many different muscle imbalances to cover them all in one video, but the primary ones that are going to affect your everyday function fall in two categories. You have your strong prime mover muscles that largely move you in a forward-backwards direction. Those would be things like your quadriceps, your glutes, and your hamstrings. And then you have your stabilizing muscles, the ones that are in the side-to-side and rotational plane. These are usually much smaller muscles, and you don't use them to produce force when you're doing things like walking, squatting, or getting up from a chair, but they're important to stabilize you side to side to allow the prime movers to work better. And so we'll go over one exercise to help strengthen each one of those things. The first exercise for your large, strong prime mover muscles, the ones that move you in a forward-backward plane, is just a sit to stand exercise. And you can do this by leaning forwards, getting your weight over your feet, and then coming back up to a standing position. Now you want to make sure that you keep your hips, knees, and toes all aligned when you're doing this. You don't want to allow your legs to drift inwards. So this focuses on both the prime movers as well as the stabilizers that move you side to side. So keep everything in alignment. Squat back down by pushing your hips backwards, and then come back up to standing by pushing your hips forwards. So you're going to push your hips backwards to sit down, lean forwards, and push your hips forwards to stand up. Now you do this movement frequently throughout the day, and rather than doing one set of 15 or one set of 20, if you're deconditioned or your muscles have gotten weaker, you may need to start with smaller, more frequent sets. And so every time you stand up from a chair, if you think about doing 5 times for every time you're going to stand up, when it's feasible and you're not in public and it wouldn't be embarrassing, that's a great way to increase your muscle strength throughout the day. Now, if you do want to do sets of it, doing 3 sets of 10 repetitions is a great way to improve muscle strength. But if you're not there yet, just start out with doing the 5 repetitions in multiple sets throughout the day. The second exercise is to work on the stabilizing muscles, the ones that control your side-to-side and rotational movements. These ones help control your body so that you don't tip over to the side when you're putting weight on one leg when walking or going up and down stairs. And for that reason, standing on one leg and balancing is probably the best strengthening exercise for your stabilizing muscles. This uses your side hip muscles, your gluteus medius and gluteus minimus, to help keep you from tipping to the side. It also uses your hip rotators to help prevent your knee from drifting inwards that way. So start with both feet on the floor, even weight on both of them, and then shift your weight over the stance leg until you've loaded most of your weight over this leg. Now slowly lift the other leg up off of the floor, trying to keep your pelvis at a 90-degree angle with your leg. You don't want to hike up like this, or more commonly, allow your pelvis to drop down like that. So stay at a 90-degree angle like this and try to work up to holding it for 10 seconds. The ability to stand on one leg for 10 seconds or longer substantially decreases your risk of death within the next year. So it's very important to improve your stability on one leg. Now, if you can't do that just yet, it is okay to hold on to something, a counter, a bed, a cane, a walker, for a little bit of stability until you're able to stand on one leg without holding on. So those were 2 exercises to strengthen your legs. The squat or sit to stand to strengthen your prime movers, and a single leg balance exercise to help strengthen your stabilizing muscles. Remember, it is important to figure out what's causing your leg weakness in the first place, because there are 3 different things that can cause your leg weakness: a neurological cause, a deconditioning cause, and specific muscle imbalances. And if you have a neurological cause, all the strengthening exercises in the world aren't going to make a difference if the signal isn't getting from here down to there. And if you have a deconditioning cause, you're not going to be able to walk long if you don't increase the mitochondria in your muscles. So make sure that you do find the cause of your leg weakness before you jump blindly into doing strengthening exercises. Now, if you are in the St. Louis area and you need help to find the cause of your leg weakness, we'd be happy to help you at More for Life. And if you're watching this from somewhere else, check out our other tips to improve balance and stability in these videos over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.